Hello viewers, hope you all are fine. So this is Dr. Sudha and I welcome you all to this video which is based on non-communicable diseases, and today we will discuss a part of that non-communicable diseases, that is hypertension and obesity. So it will be the third class of Unit 4. And before going to the discussion, I would like to request you that if you are new to my channel, or if you are already watching my channel but till yet you have not subscribed the channel, so for your better finding of the videos, you please subscribe the channel and share among your friends, because your in all your colleges and your competitive examination, for appearing any type of competitive examination or for appearing your internal examination and your university examination, this channel will help you a lot. So please subscribe and watch till the end of this video. So if you will watch till the end, you will be able to know what do we mean by hypertension, okay, and then your then its definition, then how we measure the blood pressure, okay, then sign and symptoms of hypertension, so assessment and diagnostic findings, then your risk, what are the risk factors, then dietary approaches to stop hypertension, then what is obesity, okay, then what is body mass index, what are the cause of obesity, then your what are the complications of obesity, then how we can treat the obesity, okay, all these things we can know from this video, okay. So please watch till the end and you will be able to understand all the fundamental things related to this chapter, okay. So let us directly go to our discussion. So hypertension is an abnormally high blood pressure, so that we call as hypertension. When our body blood pressure will be abnormally high, okay, then we will be suffered by hypertension, especially arterial blood pressure, because you know that we have systolic and diastolic measurement of blood pressure. So what is that, we will discuss later on. So blood pressure is the force exerted by the blood against the walls of blood vessels, okay. This is the picture how the your exert, or how the force exerted by the blood against the walls of blood vessels, okay. And hypertension is usually indicated by an adult systolic blood pressure greater than 150 mm mercury, or a diastolic blood pressure greater than 90 mm mercury, with a consensus across medical guidelines, okay. According to medical guideline, this is the measurement level for your blood pressure, which we will term it as hypertension. This means the systolic reading means the pressure as the heart pumps blood around the body, that is the systolic, that will be over 140 millimeter mercury. And diastolic reading means as the heart relaxes and refill with blood, means your heart is pumping, okay. So when it is squeezing means it is releasing the blood, okay. And When it expands, it refills with blood. So that diastolic reading should be over 90 millimeter mercury. According to the 7th report of the Joint National Committee on Detection, Evaluation and Treatment of High Blood Pressure, the hypertension can be categorized into different types. So one is your normal, then pre-hypertension, hypertension, then hypertension stage 1, hypertension stage 2, okay, then hypertension crisis. That when it will reach in hypertension crisis means you need emergency care, okay. So normal is when your systolic measurement or upper number will be less than 120 and diastolic or lower number will be lower than 80. And pre-hypertension is your between 120 to 139 or diastolic will between 80 to 89. Then hypertension stage 1, in hypertension stage 1, the systolic or upper number will be in between 140 to 159 and the lower number, that is diastolic, will be within 90 to 99. Then in hypertension stage 2, 160 or greater or 100 or greater. Lower will be 100 or greater and upper will be 160 or greater. Okay. Then hypertension crisis. Okay. Hypertension crisis, that is greater than 180 will be your upper number and lower will be greater than 110. Okay. Then hypertension can be defined as high blood pressure, okay, and it can be found out that it is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. Then the B.Sc will be more than or equal of 140 millimeter mercury and diastolic will be more than or equal of 90 millimeter mercury, isn't it? So we have already discussed pre-hypertension, hypertension stage 1, hypertension stage 2, okay, and your measurement of blood pressure. How we are able to know that the systolic blood pressure is this much and diastolic is this much? So there is a measurement system, okay. So regular of normal blood pressure is carried out by cardiac output into systemic vascular resistance, okay. So systemic vascular resistance is an index of arteriolar compliance or constriction throughout the body, and it is the resistance that left ventricle most overcome to pump blood through the systemic circulation, okay. That is your systemic vascular resistance. And cardiac output is the amount of blood pumped by the heart per minute, okay. The cardiac output is usually expressed in liter per minute, and a normal adult has a cardiac output of around 5 liters of blood per minute. So overall, approximately 20% of the world's adults are estimated to have hypertension. Worldwide, approximately 1 billion people have hypertension, contribution to more than 7.1 million deaths per year, and the age-specific prevalence was 3.3% in group aged between 18 to 29 years, 13.2% in group aged 30 to 39 years, 22% in group aged 40 to 49 years, then 37.5% in group aged 50 to 59 years, then 51% in group aged 60 to 75 years. Then let us know about the signs and symptoms. What are the signs and symptoms of your hypertension? So severe headache, then fatigue or dizziness, then vision problem, chest pain, difficulty in breathing, irregular heartbeat, blood in the urine, then pounding in neck or ears. It is often called silent killer because it is frequently asymptomatic until it has become severe. Okay. Then how we will assess? Assessment and diagnostic findings. So history collection like family history of HTN, DMC, cardiac or renal disease, then medications and dietary history, then smoking history, dietary history and stress and coping, then previous documentation of high blood pressure including age, okay, then history of all prescribed and medications. Then diagnosis can be done through different processes like your manometer, electrocardiogram, then echocardiogram. So manometer is your mercury aneroid or electronic devices is used in measurement of blood pressure. So it should be calibrated frequently and routinely against standards, so typically every 6 months to assure accuracy. Then electrocardiogram, a test that measures the electrical activity, then rate and rhythm of your heartbeat via electrodes attached to your arms, legs and chest. The results are recorded on graph paper. Okay. And then echocardiogram, this is a test that uses ultrasound waves to provide pictures of the heart's valves and chambers, so the pumping action of the heart can be studied and measurement of the chambers and wall thickness of the heart can be made. Okay. Then complication of hypertension, that is heart attack, then your neurological, then renal failure, then retinopathy, then blood vessel damage, then headache. Okay. So these are the complication of hypertension. Then what are the risk factor? Risk factor is one is age, chance of your after 50 years, okay, is more. Then alcohol, smoking, then excessive dietary intake of sodium, gender wise, then family history, obesity, stress, these are the risk factors to hypertension. Okay. Then dietary approach to stop hypertension. So what should be our dietary approach so that we can prevent or stop hypertension? So food groups like grains and grain products. So number of servings per day 7 or 8. Vegetables 4 or 5. Fruits 4 or 5. Low fat or fat free dairy foods 2 or 3. Then meat, fish and poultry 2 or fewer. Then nuts, seeds and dry beans 4 or 5 weekly. Okay. This is the dietary approaches to stop hypertension. Then let us see obesity. What are the causes of obesity? How we can measure the obesity, means body mass index. Then how what trouble it will put in on our health, and then how we can check it. Okay. So obesity, as you all are very much acquainted with this term obesity. So all of us love to have a well built bodies, isn't it? Or at least not to be obese, and we have the right to think like that, because obesity is not just a cosmetic concern, it's also a risk for some health problems such as heart disease, then diabetes and the high blood pressure and others. Then what is obesity? Obesity is that you have a high amount of fat in your body, and from that definition you can notice that obesity is not about more weight, it's about more fat. To understand this, you may weight more because you are tall and this is normal. Now you want to know if you are obese or not, and this is easy. All you want is to measure your weight in kilograms, that is kg, and your height is meters, and then use this formula that body mass index is equal to weight divided by height, that is in meter square. Okay, it is weight is in kg mass. So you can also convert it in inch. So weight into 703 divided by height square in inch. So this formula will give you your body mass index, and the obesity is diagnosed when the body mass index is 30 or more. Now look to this table, that if after putting this formula you will get your body mass index less than 18.5 means you are underweight, and if it is in between 18.8 to 24.9 means you are normal. Okay, and if it is under 25 to 29.9 then you are overweight. Okay, and if this BMI is between 30 to 40 then it tells you that you are obese. Okay, and if it cross more than 40 then it is very obese. Okay, which is very much dangerous for your health purpose. Okay, so what are the cause of obesity? Now let us discuss what are the cause of obesity. So our daily body's activity need energy come from food we eat, isn't it? And more exercise and activities burn more calories that we get from food. And not just the activities need to burn calories, also many metabolic reactions in the body need the energy from food, such as to warm up in cold weather and to sweat in the hot days. But when our body calories amounts exceed the body need, they will be stored in the body as fat. So the causes of obesity is a combination of states and risk factors that work together to store more fat in our bodies, and these factors include inactivity, then diet, then your lack of sleep, pregnancy, drugs, medical condition, genetics, then family lifestyle, then age. Okay, so these are the factors. Okay, so inactivity, without activity you don't burn as much calories, and you need to have more exercise to burn the excessive calories. And diets, some bad eating habits like high calories diet, epically in the night, or skipping a healthy breakfast and replace it by junk fast food, all of that increase the body fat, as you all know. Okay, and pregnancy, some women after the baby is born have an increase in their weight, and if they don't lose that weight with many pregnancies after that, they may become obese. And lack of sleep, this cause disturbances in the body hormones and increase the appetite, and you also may crave to high calories food. Okay, and drugs, so some medications lead the body to gain more weight, and these drugs include diabetes medications, steroids and beta blockers, then anti-seizure medication, then antipsychotic, then medications and antidepressant drugs, okay. Then medical conditions. Some diseases and syndromes lead the body to store more fat and gain weight, like Cushing syndrome. Then some diseases lower the metabolic rate in the body and lower the amount of burned calories every day, such as the hypothyroidism. And some diseases lead the patient to low his activity, such as the arthritis, or maybe the patient with paraplegia. These are some diseases, okay. Then genetically, genes affect the amount of body fat we store and where to store. Then family lifestyle is also another factor. Not because of the gene we find the obesity runs in the families. It is also because of their lifestyle and the food they eat. So we can notice that some countries such as USA have more obese people than other countries like Japan, and this is because the culture and the their lifestyle. Okay, then age, obesity could occur at any age, but when we get age, we lose more amount of muscles built. More amount of muscles give higher rate of metabolism and calories burning. When we lose them, we reduce the calories burning and tend to fill the body with fat. Okay. So now these were the factors. Now let us discuss what are the complications of obesity. Now is obesity is very much dangerous. If this answer is asked to you, then the answer will be yes. And if you are obese, you are at risk to have one or more of a greater number of obesity health problems. What are the obesity health problems? Like type 2 diabetes. Just before this class we have discussed about type 2 diabetes, and that is stored in my playlist. And if you have not watched that video, so you can watch that, okay, there. Now you can watch the recorded video. Then high blood pressure, stroke, heart disease, then gallbladder disease, then osteoarthritis, then poor wound healing, then sleep apnea, then high cholesterol and triglycerides, then metabolic syndrome, then cancer, then depression. Okay, these all are your complications of obesity. Then treatment. The healthy weight is the main goal for obesity treatment, and you can reach that by making a good treatment plan with your doctor and maybe a big team of nutritionist, dietitian, obesity specialist and nurse. Okay. This plan include dietary changes, exercise and activity, then behavioral changes, then prescription medication, then weight loss, surgery is also there when there will be emergency case. Okay. So there are some advice from doctors in order to keep yourself fit, okay, or to avoid obesity. So the first is eat colorful vegetables and fruits, then drinking green tea, then eat dark chocolate, then regular exercise, drink at least 4 liters of water every day, then maintain a healthy BMI ratio, avoid saturated and trans fats. Okay, so these are the solution or prevention methods how to remain away from obesity. Okay, so the prevention is always better than the treatment or cure, as we know. And if you feel currently overweight or your body mass index exceeds 30, you need to start your prevention program. So more exercise, that is 150 to 250 minutes of moderate intensity activity every week, is helpful to keep you away from obesity. And these activities such as fast walking and swimming. Then eat healthy, means low calories and fibers rich food such as fruits, vegetables are good food to have every day. But saturated fats and sweets and alcohol are extremely bad. They increase your body weight and threaten your health. Then monitor your weight. Monitoring your weight and calculating your body mass index will be very helpful to know how your prevention plan works. Okay, so these were some preventive methods and what should be our activities in order to keep us fit and free from obesity. Okay, so in this video we have learned today regarding hypertension and obesity and all its related informations. Okay, so with this we have completed our today's video, and I will come to you again with some another contents, new contents of your this paper AECC1 Environment Study and Disaster Management. So till then, bye bye and take care. Okay, and before leaving the channel, I would like to request you again. So please subscribe my channel and share among your friends. Okay, so that you can get the latest content regarding this video. Okay, or regarding this AECC1 Environment Study and Disaster Management. So this is one channel and your all solution. Okay, so please subscribe, and this channel will help you a lot for your AECC paper. Thank you all and bye.